welcome everyone to our 5th annual All Committees meeting of the Interprofessional Educators and Practitioners Association. Our Office of Interdisciplinary Programs is happy to host this meeting. We'll spend a couple minutes here at the beginning going over some of the rules of the road and a general overview of the office and some of our successes for the past year, and then we'll turn it over to our chair, Lynn Goldston. So as everyone's getting connected and situated, a few items to remind everyone. Sarah is recording today's meeting for those who cannot attend. She will be our Zoom moderator today as well. We will also record the chat and download that. So if there's any links or documents provided in the chat, we'll be able to record that as well. As standard, go ahead and mute when you are not speaking. We will not have any official rest breaks, so go ahead and step away today as you need to, take breaks as you need, and Sarah will try to keep us on track. The agenda was posted to your meeting request, and we'll have it posted here in the chat, and she will try to keep us on time as well. Okay. So we'll go over a couple just updates and items for everybody. So first off, I wanted to remind you that yesterday Sarah sent out our annual report. There is a link there on your screen, and it was sent out by email. It's 66 pages packed full of just different updates about what we've done over the past year, and so feel free to share that with different constituents in your departments, colleges as needed. And it's a great update just to orient you to everything that's going on this year. So give a little plug there. Our office hosting today, we also wanted to give you updates on everything that is going on within our office. We have had many different GRAs join and leave over the past year. So our office is headed by Dr. Valerie Williams, our Vice Provost for Academic Affairs and Faculty Development. We have our four full-time staff members. Sarah, of course, who you all know, Kylie Peepout, who is our IEPA simulation manager, Rama Osman, who is our project manager for Unity Clinic, and then, of course, Dr. Ruby Sheriff Sandell, who is our project coordinator for faculty evaluation measures and our evaluation programming here within the office. And then the rest on the screen, you see many of our GRAs that come from across campus, and they assist with operations of the program. This is a current layout of our organizational chart for the office. Many of you have seen this before, but as an update there, we are under the Provost office. And again, Dr. Valerie Williams is our head. Under our office, we operate with both paid and volunteer faculty members. So it outlines there our separation, but with that dotted line, of course, and then all of our support staff over to the side there. I really want to highlight that this year we've had great growth in our programming, and that is directly as a result of all the faculty who are engaged in this organizational plan. So thank you for that. And we'll spend some time just going over some of those projects that we support here. Our goal and our mission as the Office of Interdisciplinary Programs is to support the work of the IEPA, of our programs, of our accreditation standards, of our colleges. And so that is what we are here to do. And that's across all colleges. And so the curriculum plan that we support, Sarah, if you want to go ahead and progress to that, of course, all of our colleges here. Back in 2018, our curriculum committee devised this 2-year curricular plan where we would start early with first-year experiences at All Professions Day and add additional interprofessional programming available to all learners across campus. That included simulation opportunities, practicum hands-on clinical learning experiences, seminars such as elective coursework, and of course a capstone synthesis component. And so that has been our guidance over the last 5 years. And our goal is to provide programming where everyone can do something. We know that not everyone will do everything, but we need to have menu opportunities so everyone on campus has an opportunity to do something within the Office of Interdisciplinary Programs. Our Unity series there is how we organize this, and we wanted to have a thread of community service, community engagement, and focus on diversity, equity, and inclusion throughout all of what we do. And so that has been our guidance here. And over the past year, our successes have been great. And we're going to talk shortly just about some of the programming that we've delivered. But when we started this, we were delivering programming to about 800 students a year. And that was back in 2018 with All Professions Day. And you look at what we've done over this past year, where we delivered just under 2,000 students over this past year, different programming. We started with a core faculty group of about 24 faculty members across campus. And this past year, we had over 100 faculty members engaged in delivering interprofessional programming. Looking at impact of what we're doing now in the community, when you look at the vaccine outreach, that's well into the thousands, but directly at Good Shepherd, we provide care to over 300 patients. Those are underserved, uninsured patients here in Oklahoma County. And why we're all exhausted is because we provide over 500 hours of content over this past year. So that is a great menu that we have developed, and we'll just talk shortly about some of those successes. So Unity Clinic being that practicum experience, that hands-on experience, we wanted to share some of the highlights from the past year. Of what some of those 500 hours worth of coursework included. So Good Shepherd Clinic, that has been our bread and butter of the IPE experience since 2012 when we started with the EPIC Clinic. EPIC was an acronym for Empowering Patients Through Interprofessional Collaboration. But of course, that's also the name of our EHR. So we now have been referring to that as our IPE clinical experience, or as the students have so termed it, Unity Clinic. And so that same IPE experience continues with our primary community partner, Good Shepherd Clinic. We operate with 3 clinic sessions a week there, Wednesday evening, Thursday evening, and Friday mornings. And this past year, we had over 500 students involved. Over the course of an academic year, that's well over 400 patients. And so our other partner has been Cole Community Center. We saw patients there in previous years. This year, we've been engaged with their community outreach and conducted a community health needs assessment, and looking forward to continuing that partnership with them in the future. We also work with Oklahoma City Public Schools. Our pilot school was Cesar Chavez on the southwest side of town, where we conducted health fairs, health screenings, patient education, Medicaid outreach, etc. And that has been a primary partnership with OU Health. And so we do look to continue that again. Our next upcoming event is July 30th, where we will be at a central location providing services for district-wide outreach. COVID vaccine strike team. So this is where a majority of our time went this past year, was in COVID outreach. 2021 was very heavy there. We were fortunate to be selected as the strike team for OU Health to go do community pods out in the community. We partnered with over a dozen different facilities, including faith-based, community-based, government organizations, etc., to deliver that those pods out into the community. And we provided over 600 vaccines through those community vaccines. Through OU Health, though, we partnered and did a lot of the operation support for on-campus activities, where we did over 50,000 vaccines through over 300 students that volunteered. That work was recognized last year in 2021 with the Nexus Award. So want to highlight that again, that their work was recognized at the national level in 2021. Some of our other work, we worked with the Asian Health Fair, where we did some volunteer health screenings, Medicaid expansion outreach, and this upcoming year, look to work with them on hepatitis B outreach as well. We also worked with the African American Student Association with a health fair that was hosted in Northeast Oklahoma City, and look to partner with them again coming up here in August. CSU has been another collaboration that we've long been after. They've provide services to LGBTQ homeless youth here in Oklahoma City area. We provide vaccine clinics there. We assisted with the point in time count event that was held back in February, and our social work and medical students provided patient education nights and continue to look at how we can support wellness initiatives with CSU. Another large project that our group assisted with was with the Afghan refugees that have been relocated here to the state of Oklahoma. Of course, Oklahoma has taken the largest number of refugees in the country. And so we have been supporting CARE Oklahoma, Spiro, Catholic Charities, etc., in providing support to this population. We provided a Muslim patient sensitivity workshop and have also prepared a list of common greetings to assist health professionals in communicating with this population. Our big exciting news is, of course, the mobile outreach vehicle is finally here. We received that in late April, and again, it is a HRSA funded project. It is a dual use vehicle in collaboration with the College of Medicine, where we can take our student teams out to do outreach to K-12 schools, or we can also take our health education teams out to do health outreach in the community. So look to be out monthly with that. It all wraps up to this past year. We provided the IP experience with graduation notations on their transcript as IP learners, and they were eligible for graduation cords, and over 1,700 students were eligible for that. In this upcoming year, our programs will be working on setting new requirements, minimum requirements for participation of that menu, saying how many simulations must each student attend, how many times must someone interact with Unity Clinic, for example. And so we do look to set those new standards in the upcoming year. Some other items that we delivered this past year, of course, we implemented the logic model for the creation of the evaluation plan. And then our teams have also been working on the faculty activity system that went live for campus-wide use. And this will assist us in determining faculty outcomes of interprofessional programming and providing reports for accreditation, etc., for campus-wide activities. So I say all that, and I know that was a lot of programming to go through in a very short time, but it is to set the stage to say thank you, because it is your work that has allowed us to do this. And so we look forward to the upcoming year. Our rest of our day today is going to be spent learning about different projects of our different committees, how we can start putting some glue together between different projects and initiatives, how we can be strategic about what's coming up the year ahead. And so I want to charge everyone here to maintain that goal orientation to what we're doing, that we are trying to deliver a program, a menu of options that meet accreditation requirements. Everything that we do needs to be sustainable and replicable, and that we do want to keep an eye that we are being inclusive, not just only of the community, but of all of our professions, all of our departments, colleges here on campus. So with that, I will introduce now Lynn Goldston, our new chair of the IEPA Executive Council, and turn it over to Lynn.
Margaret, thank you. Wow. That was a lot. Amazing work. I think if there is another word for amazing, let's use that. Who can provide another word for amazing? It's what a terrific year it has been, and despite the ongoing challenges COVID-19 has brought us, but look at what we all have accomplished. Good morning, everyone. To the current members, thank you for joining. For the guests and new members, we welcome you to this year's all community meeting. We make interprofessionally prepared, collaborative healthcare professionals who deliver patient-centered care. And as you can see from Margaret's report, we are very intentional in this ethos of the entire program. Our mission is to organize, recognize, and advocate for faculty, staff, and students to pursue interprofessional collaboration in all aspects of healthcare at OUHEC. And our core purpose is transforming how we work together to improve people's health. As you can see from the report, we did this last year, and we will continue to do this intentionally to meet our mission. Our purpose of today's meeting is to learn from each committee's projects and initiatives and review their projects proposals and give each member time to learn, to hear about projects, give feedback, and hopefully for new members and guests to get involved in the exciting things that we do. And overall, decide the course for the coming academic year 2022-2023. And as a part of being the Executive Council Chair, I will get to share with you the newest project or initiative. And this is the first time actually that the IEPA Executive Council embark on a project. And we think through this fresh from the press, I would say, because we finalized the plan for this, and we call it the Academic Integration Map. And I would like to begin on why we want to do this year. And I would like to begin starting in 2001 to give us an overall maybe meaning on why we want to do this. The National Academies Press and the Institute of Medicine, if you remember this, in 2001, actually the first report, the scathing report, was out in 1999. And obviously it's right there on your screen that quality of care is not consistent across the healthcare system. Fast forward 2003, still the result from their research that the report was the healthcare delivery is poorly coordinated. Again, the first report was 1999. Another report came out in 2001 with really great recommendation. And in 2003, still we were not doing well. Next slide, Sarah. And with the recommendations, education was a key recommendations from the group that put out the report. And in 2015, 1999, 2015, education is still not yet aligned with healthcare delivery system. And coordinated planning among educators, health system leaders, and policymakers is a prerequisite to creating an optimal learning environment and an effective health workforce. This is the report from 2015. And the World Health Organization joined the bandwagon. And this is like not just in the United States, but around the world. If you remember, IHI, actually where my training came from, Institute for Healthcare Improvement, if you remember the 5 million lives campaign, it was not enough. They had a 100 million lives campaign during this time. There was like this excitement and awakening throughout the country, Canada, and around the world on how bad and how poor we are producing healthcare professionals in the field. As a result, our patients suffer. And next slide. So now IPE was a joint effort from different accrediting bodies, various healthcare professionals. Katie Elliott actually is a member of that group and creating this competency for IPE. Katie Elliott is a member of our association, that we need to move beyond profession-specific educational efforts to engage students of different profession in interactive learning with each other. And the OUHEC along this time started this work, not just the University of Oklahoma, but many universities across the country and around the world. In 2011, I believe 2011 or 2012, when I began this work along with Dr. Dines, Melissa Kraft, Dr. Williams, and many others on this campus, our student cohort that year, about how their perspective, draw your perspective on how we prepare you and then push you out to the healthcare system. This is how they draw, how we prepare them. This was a very enlightening picture, an insightful picture for us as a university. Like we put them in the panel and then push them out to the healthcare system. And fast forward, now we are in an office under the leadership of Dr. Williams. This is what we have accomplished so far. Margaret's report is a result of many years of work, but we believe as an executive council, we are not there yet. We still have some activities in different profession, and these projects, sorry, if we go to the next page, if each activities that we engage in different academic programs, we actually started this work in 2019, led by Dr. Williams and Office of Interdisciplinary Programs, to have some curricular alignment template. Next slide, Sarah. So we did it, and then the pandemic happened, we stopped the work. So what we are hoping to do this year as an executive council is to engage, to embark an upgraded review of the curriculum integration of the IEPA curriculum menu with the courses offered through partnering academic programs for these three purposes: assisting any remaining gaps in the IEP curricular menu, 2, making recommendation for academic integration if needed, and 3, building capacity within IEPA to address strategic plan initiative. We have seen tremendous growth in our effort. We know we are not there yet, but the limitation to growth is capacity. And in order for us to have a 32,000 feet overview of all the IPE activities throughout our campus, it will allow us to maybe make some alignment, create some efficiency, and really build capacity. So why are we going to do this year? We believe that by creating an academic integration, what will help us identify opportunities for academic integration in all programs, and then identify unnecessary programming with regard to academic integration. We take into account that others may have merits and purpose, and then the gaps in IPE programming to meet accreditation requirements. Pharmacy and College of Medicine have done this in at least the last 4 years. We actually have our students in medicine and students through Dr. Dennis in pharmacy learn together. And this is basically very simple mid-reconciliation effort. And there are so many things, many other activities we believe out there that we can integrate and create a mechanism for our students to learn together so they can work together successfully even in time for them to practice. And then hopefully this map will inform IEPA in development of organization goals projects for the years ahead. How are we going to do this? So 2 things that we are proposing or that we are going to embark: prepare a draft content map for review by each academic program, and perhaps host focus groups as needed to discuss next steps. And what would we are going to deliver? A sustainable and replicable IPE academic integration map for OUHHC. This is the sample work that we have started. We will list all the degree programs, the courses that are currently offered, and then how it will align to different competency, and what are those activities, and then maybe identify if these activities will hit accreditation requirement, and what these activities that others can participate, other academic programs. And we have a draft work plan on how we are going to accomplish this project. We're very, very excited because we feel as an executive council, this year's executive council, we started a few years ago, more than 10 years actually. And I cannot believe I've been here for over a decade now, working in IPE, that we have matured, and it's time for us to be more intentional and then be a support and also a resource for other academic programs, especially helping them create, if not create, just maybe join some of these activities that will benefit their students. Next slide. So here, you remember the panel that our students created in 2011? This is what we hope to do as a university, as an IEPA, that our students learn together as students and work together as professionals. No longer that siloed and then put in a panel and then released to the healthcare system. So my thing is, let's work together. And so if you have any questions, you would like to be a part of this work or have any ideas, please reach out. My email is below, lynn-colston@ouhec.edu. We have a great team, and we are very excited to embark a project, not just as to oversee and lead and help advise each committee this year, but do a project of our own as an executive council. So thank you so much. And questions before I introduce our Vice Provost? None. Okay, thank you. Now, it is my pleasure to introduce our Vice Provost, Dr. Valerie Williams.
Thank you, Lynn. Hi, everybody. Happy Friday. It's just a delight to be with you all today and make this time investment together to really look at the next steps for IEPA and for interprofessional education at the Health Sciences Center and at OU. Just to get us started, the slide that's up there, there's three things that I want to touch on and then jump into looking at our evaluation plan. The first is, when Margaret started doing introductions this morning and then Lynn came on, she said, gosh, we need another word for amazing. And I'm going to add these two words, one, breathless, and the other, breathtaking. The work that you all have accomplished over the course of this past year is extraordinary, especially considering that we are still in COVID. I mean, oddly enough, a new variant is up now. There's more infection going on. Rural communities are still at high risk, and folks who are not yet vaccinated or fully vaccinated or boosted. To look at the level of accomplishment that the IEPA, the staff, the faculty, the students, and the volunteers and our community partners have put forward during this past year, and look at all of the data that Margaret reported and that's in the zip file that was sent as part of this meeting is breathtaking. I cannot emphasize enough that we seem to have found not only our stride in this work, but a level of commitment that if this can be reasonably sustained, I think that every learner, every faculty member, every staff member who wants to engage with interprofessional learning and contributions to health and wellness and social determinants outcomes will have fantastic opportunities to do that, because every piece of the work that you do adds a foundational layer to our ability to understand how to do this work well and how to do it together. So that's just remarkable. And really, I hope you're all feeling a great sense of accomplishment because of all of the work and the groundwork that you've laid and everything that's been done so far. So breathless, certainly, and breathtaking would be my two words to add. Second, I want to say, I think whether you can feel it individually or not, I want you to feel a bit of individual congratulations, because none of this would be possible without individuals bringing their best abilities forward to be part of a team. Teams are extraordinary things. They don't just sort of pop up out of nowhere. Teams exist to be functional in some regard, to support one another in some ways, to make something bigger happen than what individual people could do. And every person has to make a choice about that, because we all have so much going on that requires our individual attention to the things that only we are responsible for. And teams pull us into attending to things that we are responsible for as a committed group of people working with a shared purpose. So I want to say thank you to you individually because the strongest teams come from the strongest individual players, from people who recognize how to lead, how to follow, how to lean away, how to lean in, and how to bring their part to the table. So please take away from this retreat today, although there will not be any breaks, a bit of refreshment to the idea that your contributions as an individual player on a team makes this whole process so much better and so much more effective. So I'm counting on that as we go forward. And though folks sort of, and Lynn, bless you, thank you for the work that you're doing as well, and others for saying, oh yeah, Valerie's leading and doing this. My job is to stay as much behind the scenes as possible, and to push you guys into the forefront to make sure that what you're doing is what gets noticed. So I am happy to be a member of this team. I'm happy that I have the player role or position that I have, so that I can help support what you're doing and help lift up the visibility of what you're doing. But you guys are doing a fantastic job, Margaret and the team in the office, all of the chairs, Lynn in her leadership role, everyone who is a part of this is doing a fantastic job. Every time you say something or bring an example forward about what interprofessional education means and how we're doing it as a collaborative effort, and in this sort of this team sense where our individual strengths build for strengths for the whole place. So I won't go back over all of the updates and things that Margaret brought to your attention. I will commend to you that report is extraordinary, the annual report. It's a big bad mama jam, as they say. There's a lot of really great stuff in there, and I know everyone worked really hard to put it together. So I hope that you will use the opportunity to read it and to share it with others, and or point out highlights to people. You know, it's kind of like a really good manual for things. You don't have to necessarily read everything cover to cover to get a really strong sense of what the accomplishments have been by sampling pieces that fit other folks' interests and pointing them to that. And that would mean that we also need to continue bringing people into the fold in some capacity if we can, not necessarily because they'll want to do interprofessional education, but because understanding what it's about will help them play their roles and support it going forward. So I'm sure there's lots of food for thought in the report, and I commend it to you and to your colleagues, even if they're not directly involved in IPE. And Sarah has dropped it into the chat, which is fantastic. So strategic plan wise, let me just say quickly that since the IPE initiative started in its form as EPIC, right, from 2018, or actually pre-2018, back when Lynn was talking about 2011, 12, 13, 2016, when we got the new IEPA competencies. From the time that the original team began to now, there's been a strategy. It hasn't always been as well designed as the strategy that Lynn outlined for you just now in terms of talking about the IP integration project, but every piece of it has been a building block that we've leveraged to move on to the next thing. So we are continuing to do that work, and the place that IPE has in the sort of the strategic direction of the university is really in every single mission in some form or another. So I want you to keep in mind that while we're talking about interprofessional education, we're also talking about the bigger mission and strategic direction of the university, and looking for ways to engage what we do here with every aspect of what a learner has access to and with what faculty are doing broadly. Our main focus is on the learners, but remember, by focusing on what our faculty colleagues do in not only in teaching, but also in research and service, our research faculty also teach and mentor students and provide them opportunities for looking at different ways of different kinds of questions that need to come to the table, whether that's in basic sciences or translational research. So in that mentoring capacity, research is still a component of what we need to pay attention to in faculty relationships. In service, it's a bit more obvious because of our relationships in terms of direct care, in terms of community engagement and outreach and public health, and a whole variety of ways that we touch on what's happening in the community at large, at a population basis, as well as on a patient by patient basis. So that connection, even if we are not doing a lot of literally direct service in every single thing, that connection and how people learn about where is interprofessional a crucial component of what's happening in a patient's experience. That needs to be part of what all learners and what all faculty can appreciate, and the staff who work within those environments. And so then back to our teaching environment, our strategies and this academic integration project that Lynn just described to you is an important piece of each college building a framework for not just what we do in ITE through the IEPA and through the office, but also how interprofessional education is integrated into the fabric of what learners are getting throughout the course of their education as a component, not as a set aside. We used to, in special education, we used to call it, do you do pull-out programs for your kiddos who have special needs of some kind, or you do integrated instruction? And we're into how do we integrate instruction? How do we make it as seamless as possible so that for us as professionals, we can move seamlessly from one role to the other, whether we are a team member, whether we are independent, whether we are leaning in or leaning back because somebody else needs to lead. We need to understand how that works and how we frame up who we are in the work in that regard. So we are definitely looking forward to all of the committees having a successful year ahead and engaging as richly as possible in terms of the tasks that the committees will take on going forward. And what I want to jump to now is, and you all are welcome to ask me questions at any time, certainly. Now, it doesn't have to be in this forum since we have such a full agenda today. And I think our main purpose is to be sure that we are focused and intentional about what we're doing, that we understand that mission creep is something that's always a risk, where we will stretch ourselves too far to actually to have the kinds of outcomes that we need. So that purposeful focus and intentionality around any of the things that are going on in terms of the educational, and I use that as a little e, education across the mission, will help us continue to build really strong programming, really strong outcomes and experiences for our learners and for our faculty and staff colleagues, and build on the foundation that was established years ago by the folks who got this work started here at the Health Sciences Center. So Sarah, you can go on to the next slide if you would, which is our evaluation plan. So the program evaluation is a key component of what we need to be able to do to report on, to measure, to identify what we're measuring and to report to stakeholders. Stakeholders are numerous. So the Office of Interdisciplinary Programs and the IEPA, the Interdisciplinary Educators and Practitioners Association, are committed to expanding this comprehensive and cohesive and competency-based menu of experiences that are evidence-driven, right, about what we know works. So since 2017, the office and the IEPA have been implementing this sort of really robust program that you've heard a bit about this morning, and have been building our capacity to evaluate the program and report to the stakeholders that are campus-wide and community members about the effectiveness of the programming and the impact that faculty have had, right, that faculty have had to date. So as the program has continued to expand, we needed a formal evaluation plan that can measure impact and outcomes. And I don't know how familiar you are with evaluation, but we have colleagues, one of the benefits of interdisciplinary, right, is we have colleagues who actually know this stuff. And my job in Washington was to be an evaluator for the National Institutes of Health. I'll talk about a fun job, that was fun, in the Indian Health Service. So evaluation is at the heart of some of my background. And I want to talk to you a little bit about what's on the slide that's in front of you. So the program plan, evaluation plan purpose is to do three things: structure, evaluate, and report. Provide a structure, do the evaluation, and report it. The structure means that we are looking at ways to have consistent data collection and the ability to analyze those data around metrics that matter. The evaluate component is to look at creating something that's sustainable, because the thread of what we're trying to accomplish needs to carry forward from where we started, needs to carry forward in time as the university continues to evolve its activities, but also as we have new opportunities. So that sustainable process for evaluating impact and outcome is something that needs to be a legacy project of the IEPA and the office working jointly together. And then in terms of the reporting, we need to be able to produce results that tell the people who support this effort, all of the stakeholders, whether they be community members or leadership like the provost, the deans, the senior officers, the president of the university, that these programs are of high quality, that the students who participate in them are getting a tangible benefit, and that we can be assured that that benefit is something that they can carry forward. So next slide here's our plan for 22-23 for the new academic year, which is process, impact, and outcomes. The process metrics are to looking at what's the experience that people have as participants in the IEP, in the interprofessional education program, as sort of program activity level kind of reporting. The impact are looking at metrics in particular, so that, and we're using the JTOG, the Jefferson produced document that helps us collect consistent data about learner experiences and get feedback from both learners and from faculty participants and other participants in those experiences. So that will help us to have very consistent data. And then outcomes wise, we're looking at developing program objectives that align at the strategic level with our strategic plan for the 3 years ahead, meaning through fiscal year 26, so that we actually have a projected look forward. So our ask of you is to, at this point in time, is the draft plan is in the documents that Margaret sent out ahead of the meeting. It's in the zip folder. And we want you to, your assistance in helping the evaluation team look at the plan and the goals for 22-23, and then get your insight and perspectives about that. Is anything missing from the plan? Are there additional types of objectives that you would like to have considered that to align with where the program goals are going? And what do we want to include in the update for spring of 23, meaning the kinds of things that could be reported at that point, or that might be highlighted as next steps. We're close to reporting, but maybe we only have activities so far, but the activities are looking robust. So we will, Mary Gowan has been our guide through all of this. Dr. Mary Gowan is just a fabulous individual. And for those of you who know her, I'm sure you know that about her. And she comes to us with expertise in doing this kind of evaluative work, and has done a really nice job working on the draft strategic plan with the team. So if you would send your feedback by August 1st, give you almost a month of time to send it by August 1st to Mary Gowan. Mary's email is mary-gowin@ouhsc.edu. And Mary will be happy to have that feedback as we finalize this plan. So that is the ask, and I'm happy to answer any short questions people may have, but I will turn it back over to Lynn for the next component of the meeting. Thank you all. Thank you so much.
Now that was breathless and breathtaking, because Dr. Williams, that will mesh well with the Executive Council project this year. An impact plan, an evaluation plan. And I know we have quite a few evaluation and assessment gurus here. So any feedback, suggestions, Dr. Gowan is here. I'm so glad that Mary is involved in this effort. From my office, I think the newest Assistant Dean for Medical Education, Dr. Clayton, is here. Yay, could probably give feedback as well. So please look at the document. It is in your packet that was emailed out to you with the calendar invite for this meeting. And I'm really excited because this will mesh well together what the Executive Council is going to do, the project that we're going to do this year. So next up, let me call on our newest chair, Danielle Pollen, for the IEPA Student Faculty Committee report. Oh, is it Danielle or Reina?
Well,
Lynn?
we had, yeah, I was gonna say, go ahead. Sorry. This is Ruby. I think we're going to, me and you, going to give an
is it
update about this
us?
committee. But of course,
Okay.
welcome Danielle and Reina for sure. Yes.
Okay, it is us first to review what we have accomplished last year.
Yes, we didn't want
Thank
to
you, Ruby. Go
didn't want
ahead.
to take your credit, so it's going to be you guys presenting.
Ruby, go ahead.
Okay. Well, good morning, everyone. Sorry for that little confusion, but it's really a pleasure to be here today and to see all of you, and all of you had the opportunity to come and join us in this retreat and hear about the great accomplishments of our team and our HSC community. I'd like to say thank you to all of you, and also welcome Danielle and Reina to this team, to this leadership for the ISC. I'm pretty sure they're going to be amazing leaders, and they just throughout this whole process, they've been with us, just great people to be with. And also thank Lynn. I've had the privilege to be on this committee with Lynn Golston and an amazing team of very motivated students, which we have with us today, our new ISC chair, Sam Swafford, as well. So I would like to start here by saying that this committee is charged of developing, maintaining, coordinating IPE program proposals. And as you've seen, and if you heard about our many proposals throughout the years, this can't be accomplished without the help and the assistance of our great student community here at OUHSC. Next slide, please. So this committee deliverables is, of course, developing new, as you always see, we always have new things to talk about and to mention and to collaborate on. So it's always developing a series of IPE events, such open houses, and every kind of collaboration and networking event, IPE related with our colleges, our various colleges and departments across of our OU community. This committee also works to develop, of course, and enhance professional collaboration, and this can't happen without developing mechanisms to enhance collaboration, whether it's electronic engagement or the many, many innovative strategies. As you've seen, electronic engagement has helped us so much throughout COVID. So we've been able to stay connected with our teams, with our stakeholders, and with our OUHSC community in general. And also this committee investigates every way possible to develop more IPE events for students. Mainly, we talk about possible development of student-run clinics. And I say possible here, and I bit pause because it's been a great privilege to have this possible component actually happen and become reality in one of our great accomplishments, which is the Unity Clinic and our many to serve the patient populations. Of course, our community outreach initiatives as well, the vaccine clinics, as Margaret mentioned before, and just the collaboration with Good Shepherd Clinic, with our Cole Community Clinic, and of course, we're just looking into more collaborations throughout the years to come. And we're always in the need to identify more faculty to join the team, licensed professionals to support this great initiatives, student-led initiatives for sure. Next slide, please. And here is just a brief items to discuss about the success in the last year. Of course, all of you have heard about our interdisciplinary grand rounds. We've had a couple of them, and we've tried to make this event every month that we have a grand round. We have, of course, the ISC is made up of student representatives from all of our 7 colleges, and we try to have an event related to a college, which is IPE event every month. We've been privileged to have a couple of them interdisciplinary impacts to student experiences. We've had the Great Debate, which this year focused on mental health being prioritized over physical health, great leadership with Dr. Amy Johnson in the Graduate College. And then we also had the last one in May, which was interdisciplinary approach to dyslexia. That was a great example. All of them are, but that was a more example of how the students collaborated together and networked and got more involvement across all of our OU campuses and more in Tulsa, Norman, and HSC at Oklahoma City. And also we had, of course, the Great Symposium, and then the Union Health. There's many, many more events, as you've all have heard throughout the whole year. And of course, just the progress and the collaboration of the students within the Interdisciplinary Student Council in general. For our 2022-2023 plans, of course, we have the Interdisciplinary Student Council and the Interdisciplinary Grand Rounds. For the grand rounds, there's many topics to discuss for sure. And the students every year, they come with amazing ideas. So this section alone, I would like for Sam to join us and give updates from the student perspective on this and just tell us about the amazing accomplishments that they have been doing throughout the year. Sam?
Thank you for that introduction. Hi, everyone. I'm really excited to be here today. And first of all, I want to say thank you to Lynn and Ruby for this past year. And thank you to the students who might watch this later who were on the council and made so many of the events possible. I'm really excited to announce that we will be showcasing these accomplishments with the Grand Rounds at Nexus this year with a poster titled The Interdisciplinary Grand Rounds Highlighting Excellence and Catalyzing Growth. The previous chairs, Dominique and Jeremiah, will be joining me in that presentation at Nexus. Like the slide says, the Interdisciplinary Student Council is a council that meets bi-weekly. We have currently 15 members with goals to grow as we can across multiple campuses, expanding to Norman with a hopeful social work representative this next year, and to our Tulsa counterparts. We don't want to forget their involvement and helping the students get involved even when they're removed from the OU-HSC campus. I'm really excited to continue with our collaborations with Great Debate, the Reproductive Health Symposium, and continuing to facilitate within the student-led programs on this campus. It's something that I almost feel is a call to action to the faculty. We as students can only do so well in communicating to our peers how important interdisciplinary education and integration is. We need the faculty to be able to support us and support our representatives as they reach out in communications with their peers. Student involvement is how interdisciplinary healthcare becomes a reality. And so using that as a jumping board to truly get the future of healthcare shaped is something that I hold very dear to my heart. One of the big pilot programs that we'll be continuing is the Interdisciplinary Grand Rounds, which will occur monthly, as Ruby said, and predominantly this is student-led, but I invite any faculty members that have ideas on what they want to showcase. If they have a team that they want to come in and have a lunch hour Grand Rounds and talk about their interdisciplinary activities and tell students how they can get involved, to please contact me after today's meeting. Our first Grand Rounds will be the week after All Professions Day. And so I invite all of you now to watch out for an email inviting you to that. And I am really excited about this. Back to you, Ruby.
Thank you so much, Sam. This is just a showcase of just some examples of the student success throughout the year. And we can't be more thrilled to have you on board with the rest of the team. So thank you so much for all of your efforts and good luck on the Nexus presentation as well. Next, okay, so here, this is just another example of more ideas and to see how our students continue to collaborate, continue to grow, and to stay focused with the interdisciplinary just initiative, keep us on our toes all the time. So this is a new idea from one of our students. I don't believe he's with us today in this meeting, but this is an initiative from one of our College of Medicine students, Ferris, and he reached out to our office. And it's basically an idea about putting together an interprofessional student-led or a student-led IEPA journal. So the idea is to establish a place or a platform for our students to publish, whether it was interprofessional education, their work in IPE, clinical or non-clinical research, in a platform in a virtual or online publication. So we're trying to put together a team. This is just a new idea. We're just proposing it, and you'll find a handout. You'll find this document in the handouts that Sarah provided for this retreat as well. And we'd love for you to go through it and ask questions and email us back. But this idea is to foster initiative to foster a great environment for students, to learn how to review, how to write manuscripts, how to give constructive criticism, and analyze data and communicate their data well to a wide variety of people on our campus, and also in general and towards our community as well. The students together put an amazing proposal, just a very descriptive proposal, and we're trying to build an editorial board, student-led editorial board. We'll have, if this goes through and everything goes well, of course, we always have to consider costs and operational expenses. And just to review this as much as we can with the help, of course, and leadership of Dr. Williams and Margaret Robinson. And we want this team to grow. We want the students to continue to have fresh ideas like this and see, but this specifically is going to be a collaboration with all of our, another collaboration with all of our colleges are on campus. We also want to expand to other campuses in the Oklahoma community as well. And just teach our students that, not only if you have negative results in your research in general with in any department or college that you're in, it's okay, those negative results will also something that to encourage students to publish and for other students to learn, because I know in research you always aim towards positive results and growing that. So I think just helping the students expand their knowledge and their expertise and reviewing and analyzing, collecting data and all that cool stuff in a team effort, in an IPE team effort, is something that we're trying to do. So please, your feedback, suggestions are always welcomed. And I hope that you have the time to review this document and enjoy it as well. Next slide, please. For here, always, like I said, our feedback, questions on whether the proposal, the interdisciplinary student council in general, our grand rounds is always welcomed, whether now in this meeting or later, if you'd like to email us or communicate with us. But of course, I'd always like to now reintroduce you again to our new leaders, Raina and Danielle. They'll be continuing this journey with our students. So please give them a welcome, and I will take any questions along with Lynn and Sam if available. And thank you so much for your attendance.
I was wondering, Ruby, Sam, Raina, and Danielle, if maybe there was a cost involved in the proposal. Maybe we can defray costs by using online platforms. OU has great platforms now that we can use to start the journal project and then go from there. And then if it is worthy for in print, we can then find a way to fund that. But I'm going to suggest maybe start with, the Norman campus has several platforms that are really quite beautiful that we can use here and copy their template and make it IPE environment and then go from there. That would probably be cost neutral, budget neutral for IPE. So that's the only suggestion on feedback I can offer, but please, I cannot wait to see that happen. Different students have different experiences, and it would be very enlightening for all of us to learn their experiences in IPE, especially the failures, Ruby, you mentioned.
That's true, Lynn. I think an online platform would be the best way to go. Of course, there's many other things that we need to discuss on various levels, but this is just a great initiative that we'd love to share with all of you in our community.
Yeah. Margaret was nodding her head. Yeah, budget neutral, and Dr. Williams too.
Yes, for sure.
That's what I do. My work is, okay, how can we do this, pursue this great idea, make it budget neutral?
And the cost is a serious concern, and we're evaluating, what are options with Norman. We've reached out to some of our counterparts down there that run journals. We've reached out to other institutions as well to see what their feedback has been from these student-led initiatives. And so we're still doing some fact finding on the cost. And then, of course, we welcome any feedback on the concept as well today, because before this idea sells along too much further, we want to have good opportunity for input here. And so it will come up again through executive council. It's not something that's a one and done today, but we did want to put this before everybody so that we could start getting some feedback. So it is in the chat if you'd like to take a look at greater details there. And of course, welcome any feedback you might have there.
Thank you. And I've noticed in the chat also, Margaret, that Sharing Dr. Williams have also mentioned the library and the many platforms that we have. And I just wanted to ensure everybody that our student leaders faculty and are pursuing that as well to get as much guidance from them and their expertise. So we really welcome those ideas. Thank you. Yes.
How's our number of attendance for the grand rounds? Sam, do we know?
Sam?
Let me pull that up. I actually had it pulled up in case that question happened.
Because I know that we were trying to do it like after hours to accommodate people's schedule. And I was just wondering if that was an effective time slot. At the College of Medicine, we're trying to move from Zoom virtual, although we're still offering it, and then allow people who feel comfortable and safe with in-person gathering to rebuild that community, that the feel that it gives being in person. And I was thinking about the grand rounds this year, if that would be a good move, but I do not know the feel of our members to see if they like that. But or is it the time slot thing, or anyway?
Well, I would say that our last grand rounds of the year, like Ruby mentioned, was over a dyslexia case. And so we had a phenomenal turnout considering that it was an evening grand rounds and most students have signed off for the day speaking. And we had over 80 participants throughout the course of that particular grand rounds. And we are considering, Dr. Williams, to look at a hybrid model, but it just comes down to hosting. Where would we host? What is central to all students? And I do think that we need to keep a virtual option open because we want to expand to our Norman counterparts, to our Tulsa counterparts, and keeping that option open is really important because not everyone can drive up to OKC on a random Tuesday.
Yeah.
And I try to be very respectful of our students' requirements because they change every day and every semester. Overall, the last numbers that we had, which will be updated for Nexus because it doesn't include that last grand rounds, we had over 145 students attend and fill out the attendance sheet at the end. So we estimate that number was actually higher. But we only had a certain number of students that actually filled out the form at the end of the meetings. And 21 staff members and 48 faculty members attended the first 5 grand rounds of last year.
That's very impressive.
Thank you. Can't take all the credit. Dominique and Jeremiah were instrumental to that last year.
Any suggestion on the topics? I think they're asking input on grand round topics from the group.
Right now, our topics kind of stand as the first grand rounds is going to be an introduction to what professional education would be and the ISE in general. We are hoping to work again with the Great Debate, Reproductive Health Symposium, and Lumina, as well as trying to host at least one case series where we follow a disease state through the teams that get to interact with and the teams and professions that get to interact with that disease state. But I would love to expand and hear any ideas that this faculty group has.
I'm going to suggest a patient safety focused grand round. Obviously. we can invite a patient on the panel and share their story. We did that in the previous year. It was really highly rated activity for IPE. This was in our building years because a student, a patient on campus meeting us and how our care that we delivered impact their lives and give us the impetus of working together, improving our communication and our systems so that no patient get hurt in our effort to healing. Anyway.
I think that would be a great idea. It's definitely important to emphasize to students that your actions have consequences, and you've got to be super careful and use your resources on an interdisciplinary team to try and catch those before they reach a patient.
Margaret, I have a fire emergency in my building. This will include Dr. Clayton. I think I need to step out of the meeting. I'll be right back.
Okay.
And if someone will take over for me.
Yes, we will.
Thank you.
Dr. Williams, you had your hand up?
Yeah, I wanted to thank Sam for the input, and also to add the thing about when involving patients and telling their story. I think because of, again, patient-centered care issues, maybe talking about how you involve patients in doing instruction, because it used to be that we would just ask people to come share, and basically they might have to relive what was not a happy experience, and then they go away traumatized by being asked a bunch of questions, and we're not thinking about how they're experiencing retelling their tale. And we're all happy, but I think that maybe part of that would be a really wonderful interdisciplinary grand rounds, is about that. How do you include people in being part of the team and make that a mutually beneficial experience? That could be kind of fun.
I would love if we had too many ideas for grand rounds to have happen every month. If it's something that we can feasibly make happen, we can definitely increase the number of grand rounds, but it's not something the students can pull off by themselves. Definitely we'll be reaching out to you guys for support.
Okay, well, feel free to continue using the chat for additional ideas throughout the day. Like I said, we will record that so that we'll have that going forward. And if we can't get to them all this year, that gives next year's group a great starting point too. So all ideas are welcome there. Think big, right? What could this really look like? What can we do there? Anything else before we move on to the next group? Ruby, Sam, Raina, Danielle?
I think we're good.
Okay.
Thank you everyone for the great feedback.
Great work. Our student engagement is so noteworthy, especially as we look at the national level and how we differentiate ourselves. And their work has been amazing. There's a nap in my room. We'll move along here to our curriculum committee now. Our curriculum committee chairs have been Jay Robertson and Blake Wesselrod. And we are adding this upcoming year Joanne Skaggs. And so Blake, I believe, is on rounds today, but we do have Dr. Robertson here with us. And so I believe you're on. You ready to take over?
I am.
Welcome, Dr. Robertson.
Thank you. So you can see our committee charge here: develop, maintain, and coordinate a multi-tiered longitudinal and latitudinal interdisciplinary curriculum with the related learning assessments. So we have strong connections with all the other teams and the importance of those assessments and evaluation. And then working on that 2-year menu of competency-based learning opportunities that are available to learners across the campuses. And I think maybe the COVID experience pushed us to go virtual, which actually helped us with some of that across the campus, across campuses goals. The curriculum updates, that you have the link there that will take you to the curriculum. It's extensive, it's divided out by focus areas, and it starts with that awareness through practice and all the way through the different options, ending with what's necessary for that transcript notation and getting that done. Also, the simulations continue to grow and become more refined. Kylie's been a strong partner with all the simulation teams and developing more consistency with the simulations and pre-briefing, debriefing, evaluation. And then Margaret already did a great job talking about the Unity series and the Unity clinics. And then that 5-year business plan is in progress. These are some of the simulations. The same thing, of course, has been going on a while, and poverty, the rest of them that were there, that are listed there. And as I said earlier, developing that template and ensuring that we have the consistency with the offerings so that we can evaluate them in a systematic way and ensure the robustness there. The Unity series, those team-based learning opportunities, continuity and alignment across colleges, and reinforcing the mixed method learning. The clinic, again, those are already shared at the beginning, and all the great work that was done in the last year tied to the COVID response and the coming of the mobile outreach vehicle, which is very exciting. And the launch party, save the date, August 26th is the date for that. Margaret, feel free to jump in if you want to add to this, or any other committee members. I know I saw Terry here and some others. Our plans for the next year are continuing to grow and develop our membership and the subcommittees, the All Professions Day, the entering activity for many of the students. That work continues as we continue to refine and hone that and support it on the virtual platform, the simulation committees, and then really diving into synthesis development. That was a large part of the last meeting that we had, brainstorming ideas and looking at ways to build that. And then clinic strategic expansion, the integration project that Dr. Golson's already shared about, and then upcoming accreditation. Questions or comments to the group? The 5-year review is due, and that will begin shortly. But any other feedback, suggestions, or thoughts?
Jay, do you have updates about All Professions Day being virtual?
Yes, it will be virtual. The day is September the 9th. Misty Miller has done a fine job in working with the committee to get that up and going. We had good responses to the last All Professions Day. All Professions Day 1 has been a little bit more consistent. We've made some changes and revisions to All Professions Day 2 and continuing to adapt that for the virtual platform. But we are looking forward to that. And September 9th is going to be here before we know it. And we would love to have more participants as facilitating those teams. The facilitators are key to the conversation, communication, collaboration that takes place there. So we welcome any and all volunteers to participate in that.
And I can touch on the clinical planning there. With Unity Clinic, our primary partner has been Good Shepherd Clinic, but we quickly run into space limitations with that facility. And with our need to ensure we have menu options available for all students, we do not believe we can deliver all of our needed clinical rotations at Good Shepherd Clinic. And so that has been addressed over the past year with our intention to expand a family medicine clinic. Of course, that was a HRSA-funded project in collaboration with College of Medicine to try to provide an on-campus unity clinic experience so that we could improve our offerings and increase student enrollment. Of course, we've run into some challenges with implementation of that opportunity on campus through the OU Health integration. We continue to work on that and hope to launch on-campus offerings soon. But with that, looking at especially the College of Nursing with their increased enrollment anticipated over the upcoming year and need to provide these opportunities across campus, we're looking at the next 3 years. Where do we need to engage additional clinical partners so that we have clinical opportunities for all students? And so Rama Osman is taking leadership on that project, working with the team to identify locations and pilot projects that we can look for viability and sustainability for those opportunities. So it would be the same curriculum of Unity Clinic, just at different locations so that you can enroll your learners at different locations, have different times, days, etc., to enroll the same experience, just with different locations. So more to come over that over the next upcoming year, but of course we welcome any discussions such as, are there opportunities here on campus? Are there other clinical partners to consider that align well with our mission of interprofessional collaboration? So welcome any feedback there.
Thank you, Margaret.
Lynn, you're back.
Yes, we're alive. No buildings burned. But we just moved academic affairs to BMSB, and we have a few research lab here. So from time to time, we have these little fires during the middle of research. And so in an abundance of caution, I usually tell everyone, hey, get out of this building. There's research lab here, truly, in this building. But anyway, we're good. I'm so happy we're all safe.
There was a comment there in the chat about Tulsa campus. So Tulsa has traditionally held the Bedlam Clinic. That has been their multidisciplinary clinical activity. And so we've been working with that team to look at what are our opportunities for engagement, where are there projects that align, such as the food pharmacy, where can we provide similar opportunities, of course, supporting Tulsa faculty in delivery of the Bedlam Clinic, sharing information between the projects, and of course, any student from any campus is welcome to any of our activities here, and we have had Tulsa students in the past either participate virtually or even drive down to different activities. That includes Norman students coming, Lawton from College of Nursing, etc. And so we have lots of opportunities there, but again, welcome those opportunities for expansion, especially mobile outreach. You know, where are we taking our bus? Our goal is to take it to all quadrants of the state for the True OK grant. And so those different partnerships are going to be key to delivering sustainable programming. So if anyone has a clinic they know of, we welcome any referrals or connections there as well. Jay, anything else?
That's all I have. Thank you.
Okay.
Well, thank you, Curriculum Committee. And for those of you who are exploring which committee to join, I'm not favoring here, although maybe I am. Curriculum committee. Like there's 4 parts now. We have one that is big, is the clinical side. For those of you who wants to know what we are doing in the community, the expansion of that. Rama Osman is a wonderful addition to the Office of Interdisciplinary Program, looking at to the expansion. So for those of you thinking about which committee, consider curriculum committee. And we can, because the executive council will be working with this committee in our academic mapping, academic integration map. And so we can use some help in that regard too. So thank you. Now let's move to report from the Faculty Development Committee. We have Christy Barbie. I know Jerry Ibe's here, and our newest members, our newest leaders, Ruby and Lisa Milhan. I don't know who will start the report.
I will start.
Hey, Jerry, go ahead.
Thank you, Lynn. So in the spirit of improv, I'm going to invoke our yes and. So yes, we definitely want people on the curriculum committee. And we certainly want people on the faculty development committee. And so you can be on every committee if you want. Well, I wouldn't recommend that, but we are looking for people at faculty development. We just have a lot of great things going on. I'm going to share the first part of our presentation, and Christy will take over. And then, of course, we do have, as mentioned on the slide there, new leadership, which we're really excited about. So our committee charge is to develop a formal faculty development program to ensure all faculty have education and training available in the 4 domains of the IPEC competencies. If we go to the next slide, our deliverables, our engagement of the campus community in such a way as to support delivery of IPE curricular activities. Okay, so we're going to give you an update on the main things that we've been doing this past academic year and the things that are upcoming that you could potentially get involved with or encourage your colleagues to also get involved with. Okay, so the first thing I'm going to cover are the seed grants. And if you, we provide a little bit of information on the next slide about the 3 seed grants, but I would definitely encourage you to review the annual report. And on page 61, I'm just going to read some information about each of those seed grants in terms of their, if we can go to the next slide, please. There we go. Thank you. Okay, so we have 3 seed grants, of course, based on the generous Wisdom Family Foundation. So the first one is our hepatitis B community screening events. The PI here is Brianna Lee. The goals for this project include, there's a lot, educating the OKC Asian community on the importance of hepatitis B screening with a team of interprofessional health students. 2, destigmatize hepatitis B in the OKC Asian community. 3, provide preventive health care for patients susceptible to hepatitis B. 4, provide definitive treatment for patients with hepatitis B. And finally, expand access to Medicaid in the OKC Asian community. So a very big project, and so a wonderful initiative there. The second one is automation of the healthcare professional circle diagramming technique for use in interprofessional clinical learning experiences, and that is led by our own Vincent Dennis. The goals for this project are to create a functional web-based version of this HPCD, the Healthcare Professional Circle Diagramming Technique, which was previously utilized by students to depict interprofessional care delivery. And they also want to test and refine the web-based version of the instrument using student focus groups and subsequently through interprofessional simulation. Another great initiative. And then finally, we have our interprofessional identity formation program. I'm serving as the PI, and we have a big group. There's 8 of us on this group, and we're really looking forward to this one. The goals of this project are to foster greater awareness of students' evolving professional identity formation within their respective profession, as well as their evolving interprofessional identity formation within interprofessional teams. The specific aims of the project include assessing how students self-assess their evolving professional identity formation and interprofessional identity formation, assess how faculty assess students' identity formation, and assess student engagement with other professionals through an interprofessional community platform. So these seed grants run the following academic year. And so you will see reports that they'll first make reports to the Faculty Development Committee, and then you'll see final reports at future IEP symposiums. So we're looking forward to those activities. If we could go to the next slide, please. Okay, so again, I would really encourage you to check out the annual report. There are profiles and a little bit of some, I'm thinking of the words here, basically call out. So people who recommended these people for awards, you can just get to see how they've impacted colleagues, how they've impacted patients. So we have a little bit of information on all of these award recipients, and I'll just share a little story here. I was in the office yesterday. We were celebrating a retirement for one of our staff members, and I was talking with Hallie Reeves here, who you see on the slide, and she was like, "Hey, come look at my office," and I was like, "Okay," and she's like, "Look at my Unity Award," and she's like, "I got my award and just made my day." She's like, "Wait, no. In fact, it made my week." And she's like, "This is just so great." And, you know, it's a great award. And I mean, she was just over the moon of receiving her award. And I assume everyone here who's received their awards and recognition is feeling the same way as well. Obviously, you know, this is all the stuff we do is a team effort, and we can't do it without people, and especially people who take leadership and take initiative. So if you see any of these people walking around your halls, or if you see them at any events, please take the time to make sure you recognize them. They're doing great work, as is everyone here. Okay, I'm going to turn it over to Christy, who she gets an award every day just for being great. So there you go, Christy, on you.
I wish, no. Yes, Jerry's gotten to update you guys about some of the most amazing things that we do, that we get to help award seed grants and help award and recognize faculty. And those were some of the biggest and I think most impactful initiatives that we've done so far. We are going to have multiple presentations from IEPA, but also a presentation about our certificate program at the Nexus Summit. So we would encourage you, if you're interested, to sign up to attend that. There is an in-person and a virtual conference that they're not simultaneous and they won't be exactly the same, but it'll have great IPE information. We're very happy to have had a seminar accepted relating to our certificate program. So that's a project that we've been working on now for years. And it is finally reached the point, and this is a huge project. So I have to say thank you for so many people helping out with this. But we have reached a point where we are going to open application to the certificate and begin providing certificate content in the fall. And we are thrilled about this. That is probably our, thank you. That is our biggest education plan for the coming year. And within that certificate, it will be as basic and fundamental in the beginning as learning what the competencies are, and then eventually into the evolution of being able to create well-planned IPE activities for the educator's environment. So whether that be in the clinic or in the classroom, or how that will work. So we're really excited to be able to help faculty learn how to do that. Ruby has been responsible for the faculty activity system, and it's now being used by over 300 faculty members. And that is a great way to document a lot of the IPE activities that we're doing. Some of our needs. the seed grants, and we have some major changes coming up to bylaws. We've already implemented some of the changes, but we still need to update the bylaws, and that will be a coming project for this year, into having past and elect positions within each committee, and changing the structure a little bit. And again, we do support Unity Week. We did do a guest lecture there on our faculty development certificate this past year. I will let Ruby talk about the things that are to come. But can we go to the next slide? So what are our certificate program needs? We wanted to provide educational resources to increase the impact of interprofessional education, to provide competency-based training, to foster collaboration by helping faculty become interprofessional through this program, and getting to know people in other areas within their own profession. We also, the intention for this is to build capacity for all of this amazing curriculum that's been developed, so that we can do well delivering that curriculum. Okay, next slide. All right, so as this, we started with a team of faculty going to T3, which was originally postponed and then eventually held as an online event because we ran into COVID, just like everybody else. So we had some adjustments to do there. But as we were working through that train the trainer activity, we started looking at how can we integrate all of the different things that we want the certificate to entail with a sound education model or background. And so this is some examples of our work and how we intend to move learners from novice to master. Next slide. And so we used several different educational models to really look at how do we integrate that information, and how do we take a learner from just knowing content into actually being able to practice that content. Next slide. So I'm going to pause here. I'm happy to answer any and every question. And I have to say thank you so much to all of the people who have participated in this certificate. We started off with just a very small group of us, and it expanded to include over 80 faculty providing input into this program. So I want to say thank you for that. And if you're aware of any of our bylaws that need to be updated, or you're interested in working on that project, we would love to have you in the Faculty Development Committee. And we would love your feedback, even if you don't want to join our committee. All right, I'm going to turn it over to Ruby and Lisa.
Thank you, Christy. Just amazing leadership, as you all know and seen over the years. I think we have a lot of work to do ahead of us, and we'd love for your feedback on the multiple projects, specifically the certificate. I know a lot of you are waiting for this amazing project to launch and to be something that's available for everyone. It is available for faculty, staff, postdocs, and graduate students as well. And it is a pilot effort at this time. So any feedback, any suggestions are always welcomed. And we are going to be updating our bylaws, like Christy alluded to. So also feedback on that is always appreciated. But please, we like to shift people to join our team as well, not taking anything away from curriculum or any of the other committees as well. All of them are great, as you know and you've seen. But please consider joining ours. And I think there's no problem with you joining 2 of them or 3. Or 4 of them, you know. We always multitask, right? We encourage multitasking, and this is just a format to encourage more networking, collaboration, and of course, leading to more publications and great presentations as usual. So we thank you all, and I can't thank our leadership for Doctors Ibe and Barbie and the whole team. Really just amazing people to work with. Thank you. And one more thing, I do want to say that I'm really glad to be accompanied by Lisa Malahan as well, a great leader. She's been on the committee, great feedback, great participation. She's just been an amazing person all year round. So I'm really, really glad to have her on board as well.
Thank you. I'm excited. I'm excited to learn. In thinking about like the contribution to this, even if it's small, and when I think of small, I think of so many people that have been in this for 10 plus years and may have resources from articles to ways that they've trained that they could even pass on as we start to build this and grow this. That would be fantastic. Because even something, I mean, if you can't make a large commitment, if you can make a small commitment like that and say, this is working for us and we're using this material or whatever to try to start to build this, that would be fantastic.
Thank you, team. I was so excited to hear all this development, especially as I screen the screen in front of me, and our funding leaders just like joined Dr. Wisdom and Dr. Bratzler. In particular, Dr. Wisdom talk about the certificate program from way back when. I don't know, Dr. Wisdom, if you can hear us. But it's so nice to see the person that really helped us kickstart this wonderful work. And we have the report, Dr. Wisdom, of our accomplishment this year. Dr. Williams just coined the new term, not really new, but breathless and breathtaking report. And it truly is. And so happy to see you here. And I think Dr. Bratzler was on the line as well, and our funding chair of IEPA. And this is our 5-year meeting, and so glad. And I just wanted to acknowledge their leadership from the very beginning, and the help and the encouragement throughout the years. It's funny, during the break, Dr. Clayton and I were talking, and I asked him, who invited you to join our committee? And it was Dr. Wisdom who went to Dr. Clayton as a junior faculty. I think you need to consider being a part of IPE. And Dr. Wisdom, Dr. Clayton is here now, and we have grown. So thank you for your work.
Let me say that I am very pleased to see the progress continues to be made, and that we have more members and more activities. And I continue to support all of the things that we do, even though my work is primarily in the department now, working with residents and faculty, because I really feel that that's where our efforts need to be at the present time, is in our departments, to get all of our faculty on board to interprofessional education. So thank you all for your efforts.
Thank you for being here. So thrilled to see you. And thank you for being here. Any feedback, comments to Faculty Development Committee before I turn this over to our Research Committee? Okay, let's go. Vince Dennis and Melissa Kraft have been leading this this group for many years. So excited to see new names on the screen. Brad Wiskor and Kit Klizinski. This is what it is all about. That's why I've always encouraged people. I know I was leading a while ago, join curriculum committee. But again, our goal here is to expand this work and get people excited, because this is what healthcare delivery should be. All of us working together as a team. And if we can exemplify this in this way, then we can model it for our students who become then the healthcare professionals of tomorrow. So I will call on the research committee. I don't know who will start.
Good morning. Hi, I'm Brant Wisker, current chair of the research committee, and all the others, co-past chairs, Dr. Dennis, and Dr. Kraft, and the chair-elect, Dr. Klinsinski is here as well today. And just like the other committees mentioned earlier, it's just been great to have the opportunity to work with these professionals who have not only done a stellar job in developing the current research committee, but also have been so forward-looking in their outlook, and we've been able to work together and truly develop some what we perceive as very strong research opportunities and forward direction. And so Dr. Dennis is the current Associate Dean for Professional and Interprofessional Programs and Associate Professor. He has expertise in faculty professional development, which is certainly greatly needed here in the
Brad, you're muted.
Yes, I'm gesticulating with my hands and have just found my little shift key. And it's a great little shortcut just in case anybody doesn't know that. If you hit your little space bar, you can put yourself right into mute and not even recognize it. Well, I'm glad I was unmuted I'm unmuted now because Dr. Kraft also has worked incredibly hard on this committee with her expertise in program management, curriculum development, and then looking forward to working more with Dr. Klasinski. And whenever I was looking him up, he has a doctorate in cultural anthropology, and it's just amazing and of course his expertise in working with a broad range of people in our communities through various backgrounds. It just really shows how we have the opportunity to not only work within our institution, but look at how the IPE has such a tremendous opportunity in the greater community. And in that regards, our charge is to develop, maintain, coordinate, and disseminate research and scholarly activity related to interprofessional education and/or practice. And our committee deliverables has been IRB approved research studies evaluating IPE activities and addressing gaps in knowledge. And we will address that just briefly here in a little bit. Some of the 2021 and 2022 successes, one, working on updated research guidance and plans. The pilot use of JTOG instrument for the 21-22 evaluations. I'll discuss that just briefly here in a moment. And the collaborations with Unity Clinic leaders on strategic research planning. Dr. Williams mentioned the JTOG tool that is utilized. That's the Jefferson Teamwork Observation Guide, and just wanted to highlight that it's a short tool. It was created for students early in their educational program to observe teams in action with a set of guidelines to help them focus their observations on behaviors indicative of good teamwork. And of course, teamwork is absolutely critical for all of our activities. And as these students and healthcare faculty and staff bring in their expertise to help train these students can evaluate those experiences and provide feedback. And the great thing about that JTOG tool is that it is an accepted metric, and there's a great amount of literature to support its utilization within higher education. So that's a definite strength. In the December retreat, there were 3 research question areas identified from the retreat. And of course, this was a significant amount of work went into the preparation for that retreat among the committee members. And so out of that, there was 3 areas. One, how do we create true interdisciplinary care teams that are founded on inclusion, respect for all members of the team, for example, patients, family members, professionals of all levels, while honoring professional ethics? And then what is the impact of these relationships, the intensities, and of course, we're planning on looking at things longitudinally, and the component of outcomes for the patient, learners, and faculty. And then finally, how does IPE increase rate of adoption of evidence-based practice in patient care? So one of the things that we're attempting to look at it for a team is sometimes that one of the greatest obstacles is people can be locked in, or we all can be locked into, we're doing it this way because that's the way things have always been done. So we want to determine how we can increase that rate of adoption for this evidence-based practice in patient care. Excellent. So we've taken the IPE data and then looking at two primary subcomponents, both the evaluation and research. And in evaluation, we're looking at the process, the impact, and the outcomes. And in a mirror of that, in research, we're looking at interventions, intramural and extramural. And so as we've looked at the research and evaluation, we've used many, and go ahead and next slide, please. During our research, thank you, by the way, during our research committee meetings that we've had, every month we've utilized the university strategic plan. We've also used the universities, the pillars of the universities in their plan, and its plan. We've also looked at the university's research strategic plan. We've looked forward and try to say, okay, well, how can our effort lead to, or potentially lead to, or contribute to a Carnegie designation? And then we've also looked at the need for meta-analysis. I'll briefly discuss that. But I wanted to go back to the OU, the pillars. So pillars of the OU initiative is one, to become a top tier public research university. Of course, we're contributing to the research here in this committee and in the IPE and all of actually the committees here. We're going to, we also help prepare students for life of success and meaning, service, and positive impact. So that's definitely contributing to the university's goal there. And then with their fourth pillar is to become a place of belonging, emotional growth for all students, faculty, staff, and alumni. That's really even what that JTOG instrument helps provide a metric for. And then, of course, positively enrich and positively impact Oklahoma, the nation, and world through research and creative activity. So for the most part, all the other committees, and of course, Margaret and Lynn and Dr. Williams have discussed today how these students, how this can engage, we can continuously enrich and engage their opportunities both here at the Health Sciences Center and in the greater community. We also looked at, of course, that university research strategic plan, and we're in great alignment with the goal 2, 3, and 4 of the research strategic plan. Goal 2, that's advanced team-based research. Goal 3 is accelerating translational research. And goal 4, expanding research in thematic areas. And so, of course, as just was mentioned by Dr. Wisdom and the other curriculum development, we are well on our way of in that effort. So we also looked at the Carnegie designation, and I'm sure many of you are even more familiar with the Carnegie designation community classification than I am. But during our research committees, we looked at that and we were trying to say, hey, how can we also intertwine our research efforts and initiatives such that we can, whenever we in the future, whenever we do more of the work associated with that designation, that we will be successful in that endeavor. And so a number of items that the Carnegie designation looks for is they look at the formation and training of strong core groups with a long-term vision. And here's where we play a significant role. They create robust data collection and selection systems. So of course, Margaret's teams, Dr. Ruby, Kat has been tremendously focused in that area. the upgrade of assessment tools. And of course, we're looking at the different types of assessment tools and how we can leverage those tools. And then of course, looking for synergies within other self-studies, and that has been clearly defined in the other committee reports earlier from here. And I think I might be ready for next slide. So 2022, 2023 plans, looking at competencies, attitudes, team outcomes, longitudinal evaluation, and focus areas. So we're looking at in competency, both evaluation plan results, team debriefings, making sure that we give obtain positive feedback and after action debriefing, secondary analysis, and then our instruments will help measure the attitudes associated with learning. And of course, more team briefing, team outcomes, where we're going to evaluate the plan results. We're going to be working towards those life circle diagrams. One of those slides actually was a good foundation for that earlier, whenever we were talking about both the excuse me here. I was just looking at earlier, just both with the research and evaluation, and then those subcomponents making life circle diagrams associated with it. We're looking at longitudinal evaluation. That's always, it's much easier said than done. However, I can, as I've worked with Margaret's team, Dr. Ruby, they have really laid a very strong foundation to be able to do that, where we can actually look at a student's experience from literally their first experience all the way through to the last experience here within the Health Sciences Center and possibly even beyond. And we're going to be able to follow those students and their perceptions and outcomes, just really have an incredible opportunity. And so it really wasn't there, from my perspective, some of the earlier statements and the true robustness of the research and the data collection that is being done as associated with the IPE. It truly is breathtaking, as Dr. Williams mentioned earlier, and it really just having experience putting together multiple publications with literally individual studies, working collaboratively with faculty members here at the Health Sciences Center, just looking at the data available that Margaret and her team and Dr. Ruby is putting together. It looks like there is a true opportunity to really have a positive impact in regards to the mission of the IPE. So we're going to continue to look at IEPA research policy, evaluation of plan results, and then forecast collaborations. A lot of collaborations could be made not only within the faculty here within these committees, but incorporating students as a part of their education here at the Health Sciences Center. So I think that is my last slide for this. But I just wanted to also ask, and of course, listen to and potentially respond to any questions for the groups from the group members here. And I was allotted a lot more time. We kind of flew through that. I don't know if my linguistic skills have improved, my verbal fluency, but I'll take any positive any positive aspects I can.
You did a great job, Brad. I was actually looking at the time yesterday during our exec council. We finished 10 minutes before time. I said, we may finish this 1 hour before time. I said, yay, we're in a roll. Any question, feedback to the committee?
I have a question just with the data collection, because it just sounds fantastic. Will there be opportunities, because of course I'm doing college of allied health, but I'm sure every college has got some IPE strategic plan goals and stuff like that, and being able to chart and show as a deliverable some changes in our students' perceptions as we continue to work to get them more involved in these activities. Would we be able to have access to that?
So I am going to yield that question to Margaret, and
yeah, So we currently have been delivering whatever information requested, basically. And the team early on started to put together a data map so that our participating programs would know even what information is available. What are we gathering? What can you ask? And a lot of that traditionally has been enrollment based or attendance based, just basic demographics, how many from each profession has attended different activities. And so now we're at the point where we can start reporting back on more robust metrics. So those outcomes of the JTOG, the team will be evaluating those over the next month, and we hope to have that data analysis done by the start of school. That's our current timeline, and then be able to report that back to our constituents across campus. And then moving forward, that evaluation plan that Dr. Williams presented earlier, and it's linked in the Google Drive that Sarah sent out, that zip folder on your meeting calendars. That includes robust metrics. So you can look through that and see what we will be gathering over the upcoming year very purposefully with the intent of returning back to our departments, colleges, and a really neat opportunity with having Dr. Whisker on the team has been the integration into a bigger data set where students themselves will be able to track their completion throughout the IPE curriculum. They'll be able to log into student self-service, see what IPE activities they have participated in, review their JTOG results on those different, and track their own competency growth throughout their IPE participation. So we'll be excited to launch that in the fall semester as well. So a lot of information being gathered and will be available to you. Once we hit that August 1 deadline of feedback on the evaluation plan, we will publish that. And so it will be available for everyone to see and utilize. It'll be on our website. We'll send that out to our program contacts, and it will include a request form so that you can request data back. And so you'll be able to log in through that form, tell us what you need the data for, when you need it, how you need it broke down, and then our team will be able to work on that and get it back to you. So that should launch, I would say, by September 1.
And just piggybacking off of that, Margaret, one of the things that Dr. Williams has also, Dr. Williams and I have looked to do is putting together data dashboards that are associated with both institutional data. And then so we are literally looking right now of how we can incorporate the use of specifically Power BI to illustrate some of these, the data reporting, so that whenever you have questions in regards to specific populations of which you may have interest in, general colleges, almost any characteristic of which we collect, we can, in a sense, slice and dice our data specific to events, collection of events, or longitudinal outcomes. So we have that strategic mindset of looking at those deliverables as we move into the future.
That is wonderful. Have a Power BI SharePoint of all of our activities in IPE, and then trend that over time to see where we have been and where we're going. That visual representation hopefully will propel some more growth and excitement and bring in new members across campus to join our effort. And we call this at the very beginning a movement, the changing or improving healthcare delivery, because that's really the aim. Is the outcome is improving the way we provide healthcare to our patients, and we're starting that through interprofessional education. Thank you so much. Can't be the right person to help lead us going forward, Brent. So thank you, and Keith, thank you, and Vince and Melissa for the wonderful work you do and continue to do for IPE and Office of Interdisciplinary Programs. If there's no more feedback, I would say this concludes the not the meeting. Although I'm excited to finish early because my first meeting with the council, we finished early. This concludes all the committee's report. And I am so excited for what is to come this academic year. Notes, copy of the annual report documents are on the Google Drive. And please do not hesitate to reach out to the office, to Margaret, to me, to the Office of Interdisciplinary Programs for any feedback, suggestions, and before I hand this over to Margaret for parting comments, and I'm pretty sure there's like a link to the survey on how we can improve this meeting. Margaret will share that. I just want to personally thank everyone for being here and continuing this work. So happy to see Dr. Wisdom and Dr. Bratzler join us. And I like what Vince said. What did you say, Vince, a while ago about Dr. Wisdom? Catalysis, only a pharmacy would use that word. And I said, wow, I love that. Early catalysis, Dr. Wisdom. Only a pharmacist would say that word. But everyone, thank you so much. I cannot wait for our next meeting. Any suggestion, feedback, please do not hesitate. That's the only way we can make adjustment to our programming is through feedback and input. Margaret?
Okay. Well, Sarah has put a link in the chat to that evaluation. So as we wrap up here in the next few minutes, I just want to charge to you as we break out, and you're welcome to stay into smaller breakouts of your committees as we wrap up to debrief or use any discussion time needed today. But again, I want to revisit that charge of where we're going. And this is our charge every year, is to ensure that we're maintaining our orientation to our goals, that I know we have lots of great ideas and a lot of passion, but we want to make sure we are goal oriented there. And that everything we do is sustainable and replicable, that we're meeting our deliverable goals, and that what we're doing are not just these one-offs anymore, but that we are looking at how we can sustain these. And where can we be more inclusive? Where can we ensure that everyone is at the table? We don't exclude anyone, we add extra seats to the table here. And so that means, who else do we need to invite? I know we talked a little tongue-in-cheek about recruitment to committees for additional help. Faculty development is always a small committee, but where can we purposefully reach out and ask others to come and be part of this? What do we need to do now for growth tomorrow, 5 years, 10 years from now? If we are going to be the national leader, if we're going to be the best IPE program in the country, what do we need to do now to prepare for that? And if there are those barriers, if we do have challenges, how do we make those into opportunities? Where do we transition from barriers to opportunities? And so everything is always on the table with us. We're willing to entertain new ideas. And so if there are those barriers, how can we work with you to overcome that? We have a lot of incredibly smart people on this call today. There's no barrier we can't overcome. I truly believe that. So as we go into this next phase, that is the charge we always want to keep focus on. What Sarah will do, for those who want to, we can put you into breakout rooms so that you can discuss any takeaways from today. The areas of feedback we were looking were any feedback on the evaluation plan, the IP student-led journal proposal, the faculty certificate that we'll be launching next week. So any discussion needed there, feel free to use that. Okay, well, there is a QR code there. And of course, that link is in the chat to the evaluation. So we will conclude today's presentation and say thank you for your time to visit with us and learn more. And we look forward to an amazing, breathtaking, breathless year and the year ahead. Thank you, everyone.